Mental illness has a significant impact on individuals' daily lives, impacting upon physical, emotional, and social health dimensions, where interests, hobbies, work, and other activities that are performed every day are affected.
There is a maldistribution of health professionals, with a shortage existing in many rural areas. This limits opportunities for people with mental illness to access important health services for support with engaging in activities of daily living. To mental health services in rural and remote communities is limited due to barriers outside of the individual's control. For example, an individual's geographical location, waiting times, policies and systems, and societal attitudes
in those areas are run by some wonderful people. Often they're not, acute mental health clinicians. So that, for me, is the biggest, scariest black hole from mental health in remote communities. A considerable distance to get there. There's huge wait lists in terms of psychologists or counselling services that come into small towns because they may be there once a month or once every couple of months, depending on what the specialist service is.
Funding is always quite a big battle, and so the programs that are available have very strict eligibility criteria, and people may only be able to access a certain capped number of sessions if they want to attain psychology intervention.
We've completely downplayed the innovation and the way that some of our rural services and rural communities have been changing up the healthcare space and changing up the education space, because they have to. Because if you don't talk to each other and you've got 6 different services flying in, the community just goes, and they don't use it, and so there it's a wasted resource.
Really crucial for the community to come together and to access the services that are available and get talking, and really use that as an opportunity to grow together and to learn about mental health. Surprisingly, a lot out here. There's lots to do. It's really busy social life, busier than I ever had in Brisbane. We actually have a lot of health services out here that are freely available to people that live out here, which a lot of people don't know about.
While I was on placement in Mount Isa, we were actually there during the event season. So there were a lot of rodeos, a lot of community events, a lot of volunteering opportunities. There were so many things. There were just so many things that we could participate in.
Real sense of community. I think that was probably one of the highlights on placement. I just felt like everyone kind of knew everyone, which was really cool.
I also find the work really rewarding because I get to travel and get to see Queensland, and then outside of work I can have a really laid-back lifestyle.
The Australian Mental Health Party has a vision towards creating a simpler system for accessing mental health services under Medicare, having nationally consistent standards of teaching about healthy relationships and positive mental health, and lastly, setting goals across a number of mental health targets. We can all find out more on the link provided and even join the party for free to support change at a government policy level. The Rural Allied Health Generalist Pathway is a 2-year program for allied health professionals to work as a generalist in an isolated rural setting. Those interested can find positions listed on the Queensland Government Health Department website included.
Thank you so much for watching. We hope you have gained some valuable information, and please help us share this video in supporting mental health in rural and remote communities.